All right, so we are live. Hello, friends. Welcome to my Friday Facts Live series. I am Dr. Shayla Toombs-Withers. I'm a plant based physician and owner of Essence of Health Wellness Clinic and Coaching. Now, in the month of April, the United States Health and Human Services Department highlights National Minority Health Month. As a healthcare professional, we do recognize that racial and ethnic minority populations in the United States suffer at higher rates from health conditions that can sometimes be prevented with proper awareness, adequate healthcare access, and understanding of our cultural differences. This month highlights how improving health communication for all can help us advance health equity for racial and ethnic minorities. So, thank you for joining me. Every week this month, I will be coming to you live with relevant health topics for improving the health of our minority populations. So stay tuned right here on Tuesday, April 11th and April 25th, as I'll be discussing particular topics related to diabetes with a fellow physician colleague, Dr. Amanda Atkins. Now, for today's Friday Facts, for improving the health of our racial and ethnic minority populations here in the United States, I want to share some health tips about breast cancer. Nope, it is not Breast Cancer Awareness Month. However, this month on the Essence of Health Tea Time podcast, I'm dedicating episodes to women's health. So we'll just further this topic today. Now, breast cancer is the second most common cancer behind skin cancer in American women. And here are a few fast facts. So, breast cancer mostly affects women, but it can affect some men also. Breast cancer mostly affects women over the age of 45. However, it can affect younger women also, with about 9% of all new cases of breast cancer in the United States having been found in women younger than 45 years of age. While Black women have a lower percentage of new cases of breast cancer than white women, Black women have the highest death rate from breast cancer, excuse me. Black women are 41% more likely to die from breast cancer than white women, despite being less likely to be diagnosed with it. Breast cancer is the leading cause of cancer death in Black women and has recently surpassed lung cancer for this ranking with decreased rates of smoking. Studies have found several factors that may be contributing to this phenomenon amongst Black women, including decreased rates of those who breastfeed their children and increased rates of Black women who carry excess weight in their abdominal area. And I want to just pause for a moment and say, let's normalize breastfeeding. I'll share more about all of the wonderful benefits of breastfeeding in a future live episode. But just know that if you're able to breastfeed, then do so. It has amazing benefits for both you and your baby. Now, back to breast cancer's effect on Black women. About 1 in 5 Black women with breast cancer have what's called triple negative breast cancer. This is a more aggressive form of breast cancer, and this rate is more than any other racial ethnic group, making Black women twice as likely to be diagnosed with triple negative breast cancer than white women. These cancers tend to be more common in women younger than the age of 40 who are Black or who have a BRCA1 gene mutation. Triple negative breast cancer differs from other types of invasive breast cancer in that it tends to grow and spread faster, and it tends to have a worse potential outcome due to fewer treatment options that are available for this form of cancer. Also, research from the American Cancer Society found that due to other socioeconomic factors, systemic racism, and barriers to access to quality health care, Black women have been found to be more likely to be diagnosed with advanced stage disease, which is usually more costly and more difficult to treat, more likely to experience delays in treatment, and less likely to receive recommended treatment, leading to higher rates of death from breast cancer. So, the take home point here is for minorities to one, be aware of your risk, and two, get routine screening because if these cancer changes are found early, your chances for survival are improved. A mammogram is the gold standard currently for breast cancer screening. Our academic groups do differ on the age that you should begin screening. So I definitely recommend you discuss this with your that you discuss your personal and your family risk factors with your personal doctor so that you can determine when is the best time for you to start screening. However, most academic groups do agree that screening should occur sometime between the ages of 40 to 49 years old. According to data from the American Cancer Society, overall, a woman in the United States has a 1 in 8 chance that she will develop breast cancer. This equates to about a 13% chance of developing breast cancer at some point in your life. However, the bright side to this is that it also means that there's a 7 in 8 chance that you'll never develop breast cancer. So let's talk about ways that we can reduce your risk. Number one, get moving. Studies have shown that exercise can reduce one's risk for breast cancer. Number two, maintain a healthy weight. Older women who have an overweight or obese weight have a higher risk for developing breast cancer. Increased weight gain with increasing age has also been associated with an increased risk of breast cancer. Number three, beware of hormones. Hormone replacement therapy after menopause can increase one's risk for the development of breast cancer, especially when taken for a prolonged period of time. Number four, for those who are able and have the desire, reproduce. Having your first pregnancy before age 30 and breastfeeding, as we discussed, for at least several months after childbirth can be beneficial in reducing some of your risk for the development of breast cancer. And number five, limit alcohol consumption. Studies have shown that alcohol intake can increase one's risk for the development of breast cancer. The essence of health is in you. Thanks for joining me today. For more health tips, grab your free copy of my ebook at essenceofhealth.link/e-book. I'll place this in the comments for you. I invite you to learn more about me, the Essence of Health Signature Coaching Program, and Essence of Health Wellness Clinic and Coaching at eohcoaching.com. You can also tune in every Tuesday to my podcast on your favorite podcast app for all things health, wellness, and plant based nutrition. So check it out on the Essence of Health Tea Time podcast. And you can learn even more about lowering your risk of breast cancer, particularly on episode 4 of the podcast, where you can get the tea about breast cancer. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, Dr.TW at EOHWC on TikTok, and Shayla TW on LinkedIn. I look forward to working with you, and I offer a free strategy session so that we can chat one-on-one about how to help you achieve your health goals this year. Have a great weekend. See you live next week. Bye.